I signed up because I thought me taking part would help other people, not dreaming that it would actually really help me. In November 2021, I received my NHS bowel screening kit and did it, sent it back. That came back all clear. Then in the February of 2022, I received a letter asking me to take part in the NHS-Galleri trial. They screened my blood and came back and said there is a possibility that you have bowel cancer. I was contacted, told that I would need to go for a colonoscopy, and that confirmed that I'd actually got bowel cancer. If your body doesn't feel right, then you know yourself, but I'd had no symptoms whatsoever. I was numb. I knew that I'd got a bit of a rocky road to travel. They explained to me that it was stage 3, but they thought that the surgeon would be able to remove it by keyhole surgery, and that's exactly what happened. It wasn't stage 4, which is where it's more advanced and possibility of spread and everything like that. And they did say it was just confined to that area. By the September, I'd finished all my chemo and everything, so it all happened very, very quickly. Had a CT scan last year and that was all clear. So I'm just going through the follow-ups now, and they keep a good eye. So I consider myself very fortunate. The NHS-Galleri trial, I think, saved my life. I don't know what my lifespan would have been if it hadn't have been picked up. And also, I don't know what symptoms I would have had if it hadn't have been picked up, and I'd have just carried on life until such time, I suppose, that you get symptoms where you have to go to the doctors, and by that time it could well have been not good news. A needle in the arm for a few seconds, I think it's a small price to pay. Now I'm wanting to be a bit experimental and live dangerously. I'm looking to do a train trip across Canada in the next couple of years, and I started the renovations on the house, so everything's looking good for the future.
Based on a clinical study of people ages 50 to 79, around 1% are expected to receive a cancer signal detected result, which includes predicted cancer signal origin. After diagnostic evaluation, around 62% of these people are expected to have a confirmed cancer diagnosis. The Galleri test is prescription only. The Galleri test is recommended for use in adults with an elevated risk for cancer, such as those age 50 or older. It is not recommended for individuals who are pregnant, 21 years or younger, or undergoing active cancer treatment. Galleri should be used in addition to routine cancer screening. Galleri does not detect a signal for all cancers. False positive and false negative results do occur.